is Ayo, and I'm back again with another video. So today we are going to be going over research topics. So like I say in all my other videos, if I talk too fast, this is a gentle reminder to reduce the speed. YouTube has that option. So let's get right into it. First term we're going to be talking about validity. Does the study measure what it claims to? An example can be a trauma scale, accurately assessing trauma, not just general distress. Reliability. Is the result consistent over time or across tools? Example can be depression test gives the same score repeatedly for the same person, right? So this test is reliable. Generalizability. Can findings apply beyond the study sample, applying results from one shelter to others in the same state? Informed consent. Participants understand the risks, benefits, voluntary nature of the study. Clients sign a form before research interview. You want to make sure you understand informed consent. I have seen questions that says what is ethically the most important thing here when it comes to research. Usually that's the answer. Informed consent. Do the clients know that they have a right to walk away? Is the research study actually asking for informed consent, or are they trying to do something where they're not letting the clients know that they are in a study, right? So you want to make sure you understand that term, and when you see questions like that, be on the lookout. Confidentiality. Keeping participants' data private and secure using ID codes instead of names on surveys. Operational definition. A specific way a concept is measured. Success defined as maintaining housing for 6 months. Independent variable. The variable being manipulated. So this can look like the type of group therapy offered. Dependent variable, right? So think about dependent. That means the dependent variable is dependent on the independent variable. The variable being measured. So let's say reduction in self-harm behaviors, right? So you can change the independent variable to get different results than the dependent variable, right? So the type of therapy. So if you have a question and it's asking you, it's talking about research and it's talking about the type of therapy and it's actually what's the independent variable, remember, research, it is the therapy. If it's telling you about what came out of the research, then it's the dependent variable, which is for here, like the reduction of self-harm behaviors and things like that. So these are some key terms. Okay, now we're going to go a little deeper and talk about, oh, sorry, I missed one. Cross-sequential research. So this is a type of research that combines cross-sectional and longitudinal to access age and cohort effects. So if you see something that has both of those, where it's talking about they are talking about people to people from the ages of 10 to 40, and they're following them for a long period of time, right? That's cross-sequential research, okay? These are just some key terms. Now we're going to get into types of validity, okay? So we got internal. Internal looks like is the change in the dependent variable due to the independent variable. No outside factors influence the drop in symptoms. External. Can the findings be generalized? So study results apply to other schools, not just the ones studied, right? I've seen questions of that. Make sure you understand what that looks like. External validity, okay? Construct validity. Does the tool measure the concept it claims to? A burnout survey truly measures burnout, not just general stress. Content validity. Are all the parts of the concept covered? A trauma measure includes physical, emotional, and psychological trauma. And lastly, criterion validity. Does it correlate with other proven measures, right? So if there's a new depression test, does it match the results of the PHQ-9? Okay? So remember these terms. Now we're going to go a little deeper. Let's get into research designs. So let's see. Experimental. Random assignment with control group. Clients randomly assigned to EMDR or no therapy. I'm going to highlight this and I'm going to talk about it again at the end. In social work, we don't really do experimental design, because why don't we do that? We don't do random assignment because that means that we're withholding treatment for people who need treatment. So with research, experimental is the best type of research, but it's not the most ethical type of research. when you have random assignment, right, you know that there cannot be any bias or anything like that when it comes to choosing sample size. But because we're social workers and we have ethics that we need to follow, that is not the most ethical type of research, and usually it's not done in social work. We usually do quasi experimental research. So there's no random assignment, um, has control and intervention groups. So clients choose between group or individual therapy. So with this, everybody's getting some type of treatment. We're not withholding treatment from anybody, right? So quasi experimental design, that is the kind of golden standard in social work when it comes to research, because we don't want to withhold services to the people that we work with. Okay, so remember that. Single subject design. So one client observed over time, tracking anxiety before and after treatment for one patient. Cross-sectional design. Data collected at one time from multiple subjects, right? Survey on job burnout across agencies. Longitudinal design tracks the same subjects over time. So you see something, we track people for 10 years, it's longitudinal, okay? Cross-sequential design, like I said before, a hybrid between cross-sectional and longitudinal. And this compares age cohorts over multiple years. And then we have qualitative, so rich, descriptive, non-numeric data. Interviews with DV survivors about support needs, right? So there's no numbers involved. And quantitative, we know that it's numerical data. Uses stats to analyze relationships. So measuring reduction in depression scores, post-therapy, maybe using the PHQ-9 to get that data and things like that. I always say like quality, quantity. That's where I remember the two. Like quantity, I can count it. Quality, I want more of it, but it's like, I can't count that. That's the way I remember in my brain when it comes to quantity or qualitative. Or you can remember like quantitative. You can remember the N as a number. That's also a way that you can remember it. But yes. Now, like I was saying before, what is the most ethical research type in social work? It is quasi-experimental. The reason why it is the most ethical type of research in social work is because we're not withholding anyone's services. We're not having a group that gets services and one that doesn't, to kind of see, okay, how effective is this treatment that we're trying to test out or we're trying to experiment on. So also too, when it comes to like smaller studies, single subject design also is an ethical way to do therapy, but it can't really be generalized. If you're only working with one client, you can't really work with one client and say, okay, I'm working with this single subject design, so now I can generalize this and say all students can do this or all people of this age can benefit from this treatment. Does that make sense? I hope so. And if you have any questions, please comment on this video. But let's get into some practice problems. So question number 1. A social worker wants to study the effects of parenting classes on stress levels. They assign some participants to the class and others to a waitlist without offering them any services. What is the most ethical concern with this study? Is it the lack of generalizability? Is it the lack of informed consent? Is it withholding treatment? Or is it selection bias? So like I said before, if we are withholding treatment from somebody, that's the top concern here. We never want to do that. We never want to say in the name of research, we're not going to be giving people treatment. Okay, so the answer here is definitely C. Let me highlight that. Like I said before, it is the most it's the top priority concern or the most ethical concern because we're not supposed to withhold treatment from people. So that is why C is the correct answer. Next, a social worker is asked to distribute surveys about trauma history to clients currently in crisis treatment. What should the social worker do first? So should they proceed with the study as the data could improve services? Ask the clients to sign a release of information, decline as this may interfere with client care, or request approval from the agency's research board. So it's asking you, what is the first thing the social worker can do? These people are in crisis treatment. Somebody wants you to go and distribute a survey about trauma history. The correct answer here, I hope we all pick C, that we are declining, as this may interfere with the client care. Now let me explain why that is correct. social workers, number one, must avoid dual relationships and prioritize client well-being. It doesn't say in the question where this person's from, who's asking you to do the survey. I'm assuming with the question stem, someone in your agency and things like that. You're conducting trauma treatment. That is your number one priority. A person wanting a survey to be done is not a priority. The most ethical thing that you can do here is you're going to deny that, and you're going to prioritize the impact or the safety of your clients and make sure that you're not doing anything that's going to jeopardize them. Because asking someone to fill out a trauma history survey while they're in treatment, that may re-traumatize them. That may make it more difficult for them to stay in treatment. So we definitely would want to decline, as this may interfere with the client care. That is why C is the correct answer. I hope that makes sense. And last question. Which of the following best describes cross-sequential research? Does it examine different groups at one time and compare age differences? Does it follow a single group over time and examine developmental change? Does it combine elements of cross-sectional and longitudinal studies, or is it randomly assign participants to treatment and control conditions? So I went over this earlier. The answer here is C. It is C, right? Cross-sequential, not cross-sectional. Cross-sectional being you stop at a point in time and you survey people that are all different ages. Cross-sequential is that you're going to do that and then also follow those people over a long period of time. So this study has to do with age-related and cohort-related to see the effects. So it kind of gives you a deeper understanding of whatever they're trying to treat and whatever they're trying to track. So I hope that all makes sense. I didn't want to make this video too long. In my opinion, these terms, if you understand them, you'll be able to answer these research questions, especially the different types of research. Understanding that quasi-experimental is the most ethical research assigned in social work. Understanding the different types of validity. Because I see questions all the time on external and internal saying if external validity is high, what does that mean? It means that whatever they're studying is general. It can be generalized. It can be put into different populations that are similar to what they just did with the group that they studied in the research. What else? Also, too, just understanding what informed consent is. Reliability, validity, independent, dependent variable. I see people get that wrong all the time. Understand that independent variable is the intervention that you're using. Dependent variable is what you are testing. So I hope this all makes sense. I hope this was clear. And I'll see you all real soon. If you have any questions, just leave a comment below and I'll try my best to get back to you. And I'll see you all soon. Bye-bye.